Now we talk about health. The chief of the World Health Organization says the expanding monkeypox outbreak in more than 70 countries is an extraordinary situation that now qualifies as a global emergency, a declaration that could spur further investment in treating the once rare disease and once seen the scramble for scarce vaccines. WHO Director General Tedros Ghebreyesus made the decision to issue the declaration despite a lack of consensus among experts serving on the UN Health Agency's Emergency Committee. Although monkeypox has been established in parts of Central and West Africa for decades, it was not known to spark large outbreaks beyond the continent or to spread widely among people until May, when authorities detected dozens of epidemics in Europe, North America, and elsewhere.
A month ago, I convened the emergency committee under the international health regulations to assess whether the multi-country monkeypox outbreak represented a public health emergency of international concern. At that meeting, while differing views were expressed, the committee resolved by consensus that the outbreak did not represent a public health emergency of international concern. At the time, 3,040 cases of monkeypox had been reported to WHO from 47 countries. Since then, the outbreak has continued to grow, and there are now more than 16,000 reported cases from 75 countries and territories and 5 deaths. In light of the evolving outbreak, I reconvened the committee on Thursday of this week to review the latest data and advise me accordingly. I thank the committee for its careful consideration of the evidence and issues. On this occasion, the committee was unable to reach a consensus on whether the outbreak represents a public health emergency of international concern. The reasons the committee members gave for and against are laid out in the report we're publishing today. Under the international health regulations, I'm required to consider 5 elements in deciding whether an outbreak constitutes a public health emergency of international concern. First, the information provided by countries, which in this case show.
The Nigeria Center for Disease Control has again warned of a possible 5th wave of the COVID-19 virus in the country, given the resurgence in the number of confirmed cases. It disclosed that about 1,332 cases were recorded in 1 week. The center called on states to ramp up testing, even as it called on Nigerians to embrace the safety protocols to curb the spread of the virus. According to the agency, I quote, in the last 8 weeks, the test positivity ratio has continued to increase. As of July 22, 2022, Nigeria has recorded no fewer than 260,339 confirmed cases, while 566,000 cases have been successfully discharged, while 3,147,000 died from complications arising from the virus. As of last Friday, the WHO reported that there were over 565 million cases globally, out of which over 6.3 million persons lost their lives. About 9.181 million cases had, however, been confirmed in Africa. It noted also that over 12 billion doses of vaccines of the virus covering first, second, and booster jabs have been administered as of July 19. Joining us now to have a conversation around all of this is Dr. Alero Roberts, a family health and nutrition expert who is also a senior lecturer at the College of Medicine, University of Lagos. Dr. Alero Roberts, thank you very much for joining us.
And thank you very much for having me.
Yeah, okay. As they say popularly, charity begins at home.
Absolutely.
So let's start from here. The Nigerian government, through the NCDC, is warning of the possibility of a fifth wave of COVID in Nigeria. But it's not only Nigeria that is warning of a fifth wave. It's a global thing. Dr. Tedros Ghebreyesus and other officials of the WHO, they've said, oh, it looks like this COVID is going nowhere.
Absolutely not going anywhere.
And we've been told that there is a surge. BA4, BA5, BA2.75 within the Omicron variant category. Why do you think this surge is everywhere and now Nigeria has joined the band?
Well, I think we need to remember that the virus is doing what viruses do. They change, they mutate, and we will continue to see these variants coming out, more and more variants, because the virus too is struggling to survive, and the virus will mutate and bring out characteristics and features that will enable it to continue to infect and reinfect the human cell. So this is what we're going to see. We're seeing it with influenza. Every year we're re-engineering flu vaccines and giving flu vaccine shots to the vulnerable around the flu season, late summer, early autumn. And it looks as if the COVID-19 virus is going to simply go the same way. And this is something we're going to just have to live with. Yes, we're definitely into the fifth wave. However, the question is, how high a wave are we going to get? For how long will the wave continue? But a wave is a wave is a wave. Whether it's a minor gentle wave with a very low curve, or whether it's extended, or whether it's a sharp, steep curve, that is what we don't know and nobody can predict. But definitely, we are in the fifth wave.
Well, the Nigeria Center for Disease Control is appealing to state governments to ramp up testing. The NCDC is saying testing is a problem. And some states have been identified as the problematic states. Lagos, the Federal Capital Territory, Rivers, and Kano.
It's funny that they should pick the rich states.
Okay.
Testing is an expensive business. And state governments really do feel the pressure on their state pockets, with the testing, because testing has to be free to the person being tested if he or she is being tested because they're ill. But testing is an expensive business. And unfortunately, of course, with many states facing so many conflicting sources, conflicting problems, conflicting pressures on their finances, testing for COVID very quickly dropped off the priority list. But if we don't test, we don't know. And this is the problem. So I'm not surprised that they named the big expensive states that as flashpoints where they know that testing can possibly be ramped up. The question is, to what end? Is it worth it for the state government to do so with so many other pressing economic issues to deal with?
Okay, the NCDC is recommending to Nigerian states to ramp up testing. The only state that has responded to this will probably be Ekiti State, where the old protocols have been reintroduced, more or less, or people have been advised to use masks, avoid, social bonding, and also avoid
That's actually
contact.
The more useful thing to do.
So
yes.
what will you be saying to other states of Nigeria?
Do the
Considering
same thing.
that Nigeria has not been able to meet, right now, even the 40% threshold.
Oh. For vaccination, I believe.
Yes.
Yes, that is true, because we can't even recommend everybody, please go out and get the vaccine. So many people may go out and not be able to access the vaccine, but simple things are still very important. And that issue of social distancing, hand washing, sanitizing, cough etiquette, wearing a mask, these are the simple things that protect one and all. And these are the things that are affordable, are easy to do. We don't have to have these large social gatherings where we push hundreds and thousands of people into the same space for extended periods of time. We don't have to do that. You don't have to go to every single party in every single event hall where you are breathing the same rebreathed air-conditioned air. You don't have to do that. You can afford to distance yourself a bit from people and ensure that if you have to go into these crowded places, you minimize the time of your exposure, wear a mask if possible. I'm not going to sit here and say that we should go back to as it was in the beginning. Please, nobody wants to see a return to that. I certainly don't. But I think if we are careful to institute some things, we can probably make sure that we flatten the curve. You remember that term? We keep the numbers low and we make sure we do not overwhelm the very fractured and weakened health system that we have.
But doctor, some people are saying that this is the flu season. That, okay, maybe it's not about COVID. Maybe it's just because it's the flu season. And that states should not panic. After all, hospitalization is very low. The death ratio nationwide in Nigeria, we're focusing on Nigeria. Okay, it's even the same story in the UK and also across Europe, where the numbers were told have gone up. So some people are saying we don't need to panic. People won't die. So do you agree with that? Or do you agree more with the suggestion by the WHO, the FDA in the US, that all you need to do is to take more booster shots and you'll be fine?
Well, if we had booster shots available, by all means, I would say let's take the booster shots. And it is true, I don't believe panic solves any situation. So please let us not panic. Let us apply science and wisdom and social responsibility. And we can all get through this. The virus is not going anywhere. It is here with us to stay. And you can see with the new and emerging diseases that we are seeing, that we're going to be battling so many fires on so many different fronts, that the thing to do is to establish some kind of social collective behavior that we can all live with, so that we minimize our risk and minimize the potentially fatal outcomes. We are not typically a flu nation, you know, so that is another issue. That's number one. Two, people have to remember that COVID can actually present anyhow. We have seen all kinds of weird and wonderful symptomatology. We do the test, boom, COVID positive. So we have to be very, very careful about that it doesn't continue to mask itself as something else, and then we miss. And that's the thing that is actually more disturbing. Whether we like it or not, we are in what we call an epidemiological transition. We have the traditional infectious disease profile, and we are also overlaying on that the non-infectious disease profile. High levels of people with diabetes, with hypertension, having strokes, cancers. So we've got a lot of pressure on a health system that is quickly going to hell in a basket. And these are the things that we have to remember. That, look, right now, my advice to every Nigerian is do not get sick. Do whatever you can to make sure you don't get sick. Because if you get sick, we cannot guarantee you health care. That is actually the bigger danger that we are facing.
Okay, but Dr. Roberts, do you think that the fact that there is COVID fatigue all over the world, governments are tired, individuals are tired, the systems are tired, is a major problem? The Nigerian government has talked about mass vaccination. Do you think that even the Nigerian government is tired of this issue about COVID? And, you know, nobody uses masks anymore. Nobody gets harassed. Do you think that, like Ekiti State, the federal government and other state governments should reintroduce the protocols and enforce them?
You ask a hard question because as a typical Nigerian, first of all, I'm going to ask, who is government? Which government? Now, there are certain states who are being run by very, very responsible people for whom the welfare of their state residents is paramount. And you can see what they will do. So that one is an aside. And like I said, what Ekiti State government has put in place is very simple, very easily doable. Advising people to minimize their social gatherings, stay apart a little bit, put on the masks. These are all things that are easily doable and cost neither the government nor the state residents a whole lot of money. Prevention has always been better than cure. As to the rest of it, Uncle?
Well, I guess that would be a message that would be very difficult to convey to this Miliking and Jolofin.
Now you understand what we are saying?
Yes.
But you see, in the Miliking and the Jolofin, everybody has to remember that at the end of the day, if you are under an administration that clearly has no concern for the common man, be concerned for yourself and your family. It is so simple to minimize the social gatherings. It is so simple to put on a mask in crowded places, to make sure you wash your hands regularly, use sanitizer. Those are the things, and luckily now we are even producing these sanitizers locally. So these are the things that I will keep insisting on. I wish we could say mass vaccination, but that is assuming that the vaccines are even available. I know Lagos has a very good supply, and if you are in Lagos State and you are near a PHC center, please go there as much as possible, get your vaccines. However, not everybody will have that opportunity, but the rest can easily be done.
Okay, now let's go beyond home and talk about monkeypox. The WHO is now saying that we are now confronted with two deadly pandemics. Well, maybe one is an epidemic, the other is a pandemic, but both are public health issues of international concern, global emergency, as Gabriel Jesus put it. So monkeypox is here with us. The big issue is that it has gone beyond endemic locations. Nigeria, Cameroon, Democratic Republic of Congo. Now it's in 75 countries of the world, as has been pointed out. What do you think countries need to do about this? So it's no longer an African disease. It's now a global disease.
So let me make you laugh. You know, just the day before the WHO, before Dr. Tedros Ghebreyesus made that statement, you know, the state chairman of the Association of Public Health Physicians had come to me and says, oh, you know, we need to run a seminar and a meeting on monkeypox at the national and at the national level of the national body. And I thought, oh, I'm just tired of this monkeypox. I just think it's a storm in a teacup. She's going to be laughing at me now as sitting here having to talk about it. But you are very right. I mean, I think the main concerns now that we have with monkeypox, and clearly this is happening even at the level of the WHO, where a committee couldn't quite come to a consensus, and it is clear that the DG has chosen to err this time on the side of caution, because don't forget he was accused in the case of COVID of being late to the Tea Party. Do you remember when he called it a public health emergency of international concern, and it was fast becoming a pandemic? The truth of the matter is the speed with which this thing has gone beyond the endemic countries and gone global from 55 to 75 countries, that is actually of concern. And because we, you know, right now we're reporting case fatality rates of 1 to 3%. Will it grow? Will it get worse? Does anybody remember how smallpox started? Were we there in the beginning? Could this be? Because, you know, monkeypox and smallpox are first cousins.
Related.
So, because we cannot say categorically where this thing will fall, which way it will go, what is contributing to that upsurge, this uptick that we're seeing? Is it new technology? Is it new ways of living? Is it new things we're doing? Is it, let me be ridiculous, is it 5G telephony? Who knows? And those are the things that now cause concern and say, let us first declare this thing a public health emergency of international concern so that we can turn everybody's eyes to it, get the scientists working again, like they did with COVID, again hand in hand across borders to make sure that we quickly find answers even to questions we have not yet asked. But, you know, this is what is driving it. And we are concerned. We are concerned. Now, the issue we would probably be asking in Nigeria, because we have to bring everything home at the end of the day, is it a case of underdiagnosis or is it a case of low prevalence? That's the question we can't really ask, because testing hasn't yet been ramped up to the level whereby we can say, okay, we have tested, it is not here. Is it that, or we are not testing at all? So these are the things we need to ask.
Okay, I mean, Dr. Roberts, you are very right that the Committee on International Health Regulations and Emergency was divided. They voted 9-6. 9 against, 6 in support. And, the Director General decided to go with the minority. However, the key issue here with regard to monkeypox is that the presentation has been more within the community of gay men. So those who voted against said, look, this will amount to stigmatization of the LGBT community. What do you say to that about sexual orientation being the vector, the catalyst for the prevalence of over 16,500 cases that have been reported in over 75 countries?
It's a very interesting thing. First of all, I'm going to switch your word gay men to men that have sex with men and call it MSMs, because that's part of what we're trying to fight, that issue of stigmatization. Okay. That's one. Two, so we don't want to confine monkeypox to a certain strata of society, whether men, whether women, whether children, whether adults. No, we don't want to do that. The first thing we have to remember is everybody, anybody is at risk of monkeypox. It is a disease spread by close contacts. Those are the two things we have to remember. So the issue of, and then we have to remember then it's also a zoonotic disease. So it has always had a higher prevalence in men, and the belief has been who goes hunting in the bush? Who is likely to first come in contact with an animal host and likely to bring it back to the home? Is more likely going to be a man than a woman. So those things have, and this is part of the science, have they actually been established? Has it actually been established that maybe the monkeypox virus has an affinity for the XY over the XX? That hasn't been established. What has been established is that everybody is at risk. And we must make sure we tailor the narrative to ensure that we do not bring up this stigmatization issue. I know what issues we had with stigmatization with COVID. You can't believe it. Where entire households were now shunned and stigmatized because one person had been taken into isolation and then brought back to the home after 14, 21 days. And we had huge issues with that, locally and globally. So that is something we just do not want to see with this. The fact of the matter is that I don't know, my speculation is that men who have sex with men and then have a health issue are probably more attuned to getting health care quickly and early. Who knows? Could that be the reason why we're seeing it more?
Dr. Roberts, but why do you think that Europe is the most endemic region for this?
As for Europe, I do not know what they have done between the war, the fires, the famines, and the floods. To add disease to it again, Europe needs to get on his knees and repent. Okay, but what do you think can be done to prevent monkeypox? Definitely, it's going to be the same thing. It's going to be avoiding close contact with people who have a fever, a cold, or a rash, which is a good idea anyway, whether you're dealing with monkeypox, influenza, smallpox, chickenpox, COVID, whatever you're dealing with. Let's keep because prevention is still better than cure. And certainly, very close contact, kissing, hugging, cuddling, having intercourse with such people is a no-no. Even if it's your dearly beloved husband and dearly beloved wife. That is the time to say, okay, you know what, let's go into fasting and prayer for this season and let's see how this thing pans out. It's between the 5 and 21 days. So if we take the outer limit of 21 days, it's not too much to ask people who are ill to isolate themselves away from family and certainly healthcare workers, because those are the two population segments that are at highest risk. Those who are caring for people who have fever and a rash, and those, whether in the home or in the health facility. So distancing again and isolation, prevention is still better than cure. Avoiding contact with bedding, utensils and whatnot that they use. Okay, we've been talking about vaccines for COVID. Is there a vaccine for smallpox? Has the world been able to address that challenge in terms of treatment, solution, prevention? There is a vaccine. We know that the smallpox vaccine has some cross-reactivity with monkeypox. So many of us, I was actually asking my husband about that, who have been vaccinated, who took the last batch of smallpox vaccine in the late 60s, early 70s, shortly before, smallpox was eradicated, probably have a higher degree of protection than the younger generation. Sadly, globally, we are in the minority rather than the majority. But to be able to ramp up smallpox vaccine production again, when most of the vaccine producers are focused on producing the existing vaccines that we need and COVID to get it around the world. This is the problem that people will have to keep realizing. The process of vaccine production is not something you can just switch on and off like a tap. It's not like starting a generator. It's not like, putting the ignition on your car. It is a process that takes time, and that time requires resources and requires all kinds of things, money to be put into it. So to be able to ramp up the production of smallpox vaccine and then distribute it around the world again. And I'm sure, if anything, I can speak to what would have informed the mind of the DG. Is probably thinking about all that he chose to err on the side of caution and say, if we have to start producing this vaccine, it's better we start now. So we don't get into a situation where it becomes a global emergency and then we don't have the tools to deal with it. Okay,
Dr. Alero Roberts, we have to go now. What would be your advice to the government of Nigeria with regard to these two issues? Poor testing, poor vaccination with regard to COVID pandemic, and also this new public health issue of monkeypox outbreak.
The government is full of people who have the technical skills and expertise to do what needs to be done to strengthen our health sector. The government just needs to do it. We can continue speaking to the common man. We can continue telling people to distance and use sanitizer and whatnot. But if we don't strengthen our health sector as an emergency, and that's something that can only be done from the level of government.
Okay, thank you very much, Dr. Alero Roberts, for joining us on this Live This Sunday Talk Show.